Intro to RAD 207 with Brandy Jones. The syllabus can be found on Brightspace in RAD 207 course. In Module 1, you can find the intro section. In that section, you can find this PowerPoint, RAD 207 outline with all topics and guest instructors, an outline of tests and quizzes, as well as a calendar. I am your contact instructor for the entire fall RAD 207. You will see me every Tuesday, and you know how to reach me. Module 1 consists of pediatrics, geriatrics, trauma, portable, mobile, and surgical units. With me, you will find in Module 1 an outline of specifically my 5 weeks and a checklist, which is an easy printable list to help follow along. Make sure you're checking the checklists and going through everything on Brightspace. You don't want to miss anything. This is a jam-packed semester. Class number 1 is on age-related radiography, geriatrics, and pediatrics. In class, we are going to go over pediatrics and have a skills lab on pediatrics. I would like you to watch, there's 3 YouTube videos, Pick a Stat, A Child's Guide to a Chest X-ray, and a bone scan study case. There is some more information about your black book, what is required. It has technique chart for techniques for you. There's an article about battered child syndrome. There's pediatric summary of clinical indications, and a page I've made up about pediatric immobilization, which we will practice in your skills lab. As far as the geriatrics go, unfortunately, we do not have enough time in our class to do this, so you're going to have to watch the geriatrics on your own. There is a YouTube video imaging the geriatric patients, which was pretty neat. I'd like you guys to check that out as well. Class number 2, Trauma and Mobile Radiography and Trauma 1 PowerPoints will be done in class. Be prepared. They are long, guys. I'm sorry. We will also take the second portion of the class and do a mid-space VR assignment. In these that I'm going to be teaching you is going to be about portable radiography, lines, tubes, fractures, positioning, and trauma. The PowerPoint medical lines and tubes you're going to have to do on your own. We just do not have enough time in class. There's a neat YouTube about spinal trauma that you guys should watch. There is the black book requirements for trauma, your trauma techniques you can use. There is the last known copy of the C-spine obliques, which was maybe a year or 2 back. You have a femur and hip explanation. Some people the one year were confused about femur and hip radiographs. There's an acute trauma protocol. That's from shock trauma when I worked there. Chest tubes, lines, and catheters. You've seen this sheet before when we did chest and abdomen. I gave this to you in image analysis. Warning, you may see graphic image material throughout this class. I definitely have some trauma pictures for you guys. Class 3, Trauma 2, and a how-to for trauma lab testing PowerPoints in class today. We will also be doing a skills lab on trauma and portables. You will not have a quiz this time, so make sure you guys are getting those black books done. All labs is next week on Tuesday and Thursday, and I will be reviewing your black books then. Class number 4 is for surgical radiography. We will be going over the PowerPoint Surgical Radiography 1. Surgical Radiography 2 will have to be done on your own. That's the procedures. Ultimate C-arm guide is something I put together. It's more for something that you would want to take with you when you go out on your own. This will help you once you start in your workplace. It's pretty much everything you need to know about C-arms. I have a few things for you to read over. There's an article, C-arm safety tips. You have a C-arm orientation document, and then there's C-arm positioning and projections that I've put together. We will have a MedSpace C-arm assignment today. There are 5 YouTube videos I would like you to watch, and these are excellent resources. I've gone through all kinds of YouTubes, and I like these the best. The basic uses of a C-arm, OAC 9900 Elite parts number 1 and 2, subtraction and road mapping video parts 1 and 2 as well. Class 5 will be your test on pediatrics, trauma, mobile, and surgical. It's in the testing center in room 129. After we finish our test, we are going to go downstairs to the classroom and we are going to do a C-arm skills lab. MedSpace, you have 2 MedSpace assignments, MedSpace VR, which is a trauma skull, and then you have a MedSpace CA, which is a C-arm hip pinning. Black Book requirements. All the Black Book criteria can be found in your lab manual, and it is still required for peds. See the document, pediatric information for Black Books. Here is a picture of it. You have chest, AP and PA, lateral, you have AP and PA, and cross table lateral for an infant, KUB, erect abdomen, left lateral to cube, dorsal to cube for your abdomens, upper extremity, lower extremity, pelvis and hips, and your skull. Black Book requirements for your trauma section. Again, all the Black Book criteria in your lab manual is required for trauma, all those sections. The document is located in week 2 for trauma. And here is an example of this page. So I would suggest that you take a card and put trauma and severe trauma and these instructions on it. All the rest are positions that you need to add. Let's talk about lab testing and then pre-tests and testing. Pediatrics. So with pediatrics, you'll get an individual lab called a PEDS practice lab, the lab before you lab test. Because you are still working on spine and thorax and head work, this gives you a chance to get a refresher before you lab test. So for pediatrics, you have one non-exposure lab test. It's for chest 0 to 6 years old. It will be in the picostat, so you will be using the dial for that, and it will be a PA and lateral erect. Exposure lab test. You will have 5 exposure lab tests that you must perform, and they are an abdomen series on a 0 to 6, which is the infant phantom we have. It will be an AP chest, a KUB, and a left lateral to cube using the Taman board. We have a lower extremity, a 0 to 6-year-old. That will be on the child phantom. This is going to be a lowered leg, a AP and lateral views. You have a upper extremity 0 to 6-year-old, and that will be the child phantom with the portable machine, and this will be your forearm, AP and lateral views. We have a NICU chest with the portable machine. This will be an AP chest with the baby phantom. We have a pediatric portable, which is any. So it could be any exam from 0 to 6-year-old. And this could be the baby phantom or the child phantom at a minimum of 2 views. All those exposure and non-exposure labs will lead up to this. Your pediatrics required pre-testing and testing. All pediatric exams must be performed on children between 0 and 6 years of age. And the categories are pediatric chest 0 to 6, 2 views, NICU portable chest, portable any, minimum 2 views. List B upper and or lower extremity. And your list B pediatric abdomen, minimum of 1 view. Geriatrics. You will learn that in class, however, there will be no lab for geriatrics. Geriatrics, pre-testing and testing. After successfully passing the RAD 207 Module 1 test, the geriatric studies that may be performed are a chest, AP and lateral, an upper extremity minimum of 2 views, a lower extremity minimum of 2 views, a hip and a spine are your list Bs. Now, The patient must be physically or cognitively impaired as a result of aging, plus the patient must be 65 years old or older. So you have to have those two requirements in order to use it as a geriatric. Portables. Currently, there is no section for lab testing on portables. Portable exams. Pre-testing and testing may be done after successfully passing the RAD 207 Module 1 test. You have portable chest critical care, which would be in your ICU, CCU, and PACU units. The patient must have a line and/or tube. You have your non-critical portable chest. You have a portable abdomen, KUB, a portable upper extremity, and a portable lower extremity. OR exams. There is no lab testing on OR exams. For OR, you may pre-test and test after successfully passing the RAD 207 Module 1 test. You have C-arm, which have a AP and a lateral manipulation, and then you have a C-arm any manipulation. Trauma exams. Yes, we have lab testing on trauma exams. There are trauma extremities. Now, you have a section in your uppers that you have a trauma upper, and then you have a section in your lowers for a trauma lower. Now, these you currently have already been allowed to be pre-comping and imaging and pre-testing and testing on. I just want to review this with you because a lot of people seem to be confused. So your trauma upper, this is a minimum of 2 views 90 degrees from each other, which is not your standard routine view. So you should not be just taking a hand or wrist and saying, oh, the rec says trauma. No, you need to be able to manipulate your tube and or positioning for this upper trauma. Same thing with your lowers, minimum 2 views, 90 degrees from each other, not your standard routine views. It has to be out of the ordinary to acquire. So cross table, angle manipulation is what you should be doing, not just because it says trauma on your paperwork. So those you should already be testing on. I just wanted to clarify what those mean. Trauma lab testing. Students have 1 hour to complete the trauma lab in all 3 of the trauma rounds. It is broken down as follows. The first 15 minutes should be utilized to prep the room and write down the scenario and get everything set up. The scenario will be placed in a logical order so the trauma can be executed accurately and swiftly. This is the only time we allow you to write it down. The next 45 minutes are used to complete the trauma exam. It will be timed, and you may not exceed the time limit. So you guys will get an individual practice lab 1 week before you actually start lab testing. So peds and trauma, you get individual lab practices because we know you guys are still working on spine and thorax, and then you have skull and face to finish up. So we give you an extra practice. You have 3 trauma rounds. The timed trauma rounds must be performed in 45 minutes. Trauma 1 consists of 5 exams performed on your lab partner with very minimal movement. This is to be performed like an ER trauma on the X-ray table. Trauma number 2, trauma round 2, consists of 4 exams performed on a full body phantom with no movement using the portable machine. Trauma 3 consists of 5 exams performed on a full body phantom with no movement. It will be like an ER trauma round on the table. Special modalities in RAD 207. Module 2. Class 6 is venipuncture. Class 7 is IR. Class 8 is CT. Class 9 is split, half ultrasound, and the second half MRI. This is also Tech Week. Class 10 is your first thing is your Module 2 test, and then after your test, you will report back down to the classroom for class. All these are guest speakers. I will be present to make sure everybody has perfect attendance. And then I want you guys to expect quizzes after each of these modalities. Module 3. So class number 10, the first part, test number 2, is technically Module 2. Mammo is the start of Module 3. Class 11 is Sexual Anatomy. Class 12 is Nuke Med, DEXA, and Radiation Therapy. Class 13 is your Module 3 test, and then we will have a review for your final. Class 14 will be your final. Guest speakers for all of these. Again, I will be there to make sure you're present and is accounted for. Expect quizzes after each of these modalities as well. All right, for RAD 207, a quick summary. You will have 2 MedSpace projects, 10 quizzes, 3 tests, and 1 final. 10 quizzes, 10 questions each. We have age-related radiography, trauma portable, surgical. Venipuncture is the only exception with 20 questions for this quiz. IR, CT, MRI, ultrasound, mammo, sexual anatomy, nuclear medicine, DEXA, and radiation therapy. Test number 1 is Module 1, pediatrics, geriatrics, trauma, mobile, and surgical. Test number 2 is Module 2, venipuncture, IR, CT, MRI, and ultrasound. Test number 3 is Module 3. You have mammography, sexual anatomy, nuclear medicine, DEXA, and radiation therapy. RAD 207, the final, is on everything. Pediatrics, geriatrics, trauma, mobile, surgical, CT, venipuncture, IR, MRI, ultrasound, mammo, sexual anatomy, nuke med, DEXA, and radiation therapy. Good luck, everybody.